Joint.
The hip joint is a multi-axial ball and socket type of synovial joint formed by an articulation between the acetabulum of hip bone and the head of the femur. Bones forming the joint. The ball. The ball is represented by head of femur, which is spheroidal, resembles about 2/3 of a sphere, and fits completely into the concavity of the acetabulum. The head of the femur is articular, except for a pit or fovea close to its center, which gives attachment to ligament of head of femur. The femoral head is covered by the articular cartilage, that is hyaline cartilage, except at the fovea or pit. Socket. The acetabulum is a cup-like depression located on the inferolateral aspect of the hip bone. Its cavity is further deepened by the presence of a fibrocartilaginous rim, the acetabular labrum. The acetabulum presents three features: horseshoe-shaped lunate surface, acetabular notch, and acetabular fossa. Ligaments. Fibrous capsule. The fibers of the capsule are spirally arranged and taut in extension and unspiraled and relaxed during flexion. The capsular ligament is strong and dense fibrous sac that encloses the hip joint. Its attachments are on the hip bone. It is attached 5 to 6 millimeters beyond the acetabular margin, outer margin of acetabular labrum, and transverse acetabular ligament. On the femur, it is attached anteriorly to the intertrochanteric line, above and below the neck. It is attached close to the root of greater trochanter and little above the lesser trochanter, and posteriorly 1 centimeter in front of the intertrochanteric crest. It is made up of two types of fibers: inner circular and outer longitudinal fibers. Inner circular fibers forms collar around the femoral neck that is called zona orbicularis. Some of the fibers of ischiofemoral ligament are continuous with zona orbicularis. Outer longitudinal fibers are reflected along the neck towards the femoral head to form retinacula. The synovial membrane lies in the inner aspect of the fibrous capsule. The intercapsular portion of the femoral neck, transverse acetabular ligament, ligamentum teres, and fat in the acetabular fossa except the articular surface. Acetabular labrum. The acetabular labrum is a fibrocartilaginous rim attached to the acetabular margin. It's triangular in cross-section. Function. The labrum deepens the acetabulum and holds the head of femur tightly to keep it in position. Transverse acetabular ligament. The transverse acetabular ligament bridges over the acetabular notch and joins up with the inferior ends of the labrum. This ligament completes the acetabular ring. It is converted into a foramen through which the acetabular vessels and nerves pass through it. Ligamentum teres or ligament of the head of the femur. It is triangular fibrous band. The ligamentum teres is situated within the capsule but is extrasynovial. Attachment. Its apex is attached to the fovea of the head of femur and its base is attached to the transverse acetabular ligament. Within the ligament runs the blood vessels that supply to the head of the femur. Iliofemoral ligament or ligament of Bigelow. The iliofemoral ligament is the strongest ligament and is inverted Y-shaped ligament that lies anteriorly blended with the capsule. Attachment. Apex or stem is attached to the anterior inferior iliac spine and area between it and above acetabular margin. Base is attached to intertrochanteric line by medial and lateral bands. The intermediate stratum between the two bands is thin. It is pierced by ascending branch of lateral circumflex femoral artery. Function. It prevents hyperextension of the hip joint. Ischiofemoral ligament. The ischiofemoral ligament is weak and supports the capsule posteriorly. Attachment. Above, it is attached to the ischium close to the acetabular margin. The fibers pass spirally upwards and laterally behind the neck of femur, and most of the fibers are continuous with the zona orbicularis of the capsule of hip joint and is attached to the greater trochanter deep to the iliofemoral ligament. Function. It prevents excessive extension and medial rotation of the hip. Pubofemoral ligament. The pubofemoral ligament is a triangular ligament covering the inferomedial part of the capsule. Attachment. Base is attached to the iliopubic eminence and obturator crest. Inferiorly, it blends with antero-inferior part of the capsule and medial band of iliofemoral ligament. Function. This ligament tightens during abduction and extension, prevents the excessive external rotation and extension of the hip. Movements of the muscles. Flexion. Psoas major, iliacus, sartorius, rectus femoris, and pectineus. Extension. Gluteus maximus and hamstrings. Abduction. Gluteus minimus and gluteus medius, tensor fascia latae and sartorius. Adduction. Adductor longus, adductor brevis, adductor magnus, pectineus, and gracilis. Medial rotation. Anterior fibers of gluteus minimus and medius. Tensor fascia latae. Lateral rotation. Piriformis, obturator externus, obturator internus, and quadratus femoris, and the superior and inferior gemelli. Relations of hip joint. Anteriorly. Anteriorly, tendon of iliopsoas separated by a bursa. Lateral fibers of pectineus and straight head of rectus femoris. Femoral nerve between the iliacus and the psoas. Femoral artery. Femoral vein. Posteriorly, piriformis, obturator externus, obturator internus, superior and inferior gemelli, quadratus femoris, and gluteal maximus. Superior gluteal nerve and vessels. Inferior gluteal nerve and vessels. Sciatic nerve. Posterior cutaneous nerve of the thigh and nerve to quadratus femoris. Superiorly, reflected head of rectus femoris, gluteus minimus, gluteus medius, and gluteus maximus. Inferiorly, lateral fibers of pectineus and obturator externus. Bursae around hip joint. The hip joint communicates with the psoas bursa through a circular aperture between the pubofemoral and iliofemoral ligaments. Bursae around the hip joint are 7 in number. Four under gluteus maximus, 1 under gluteus medius, 1 under gluteus minimus, and 1 under psoas tendon. Blood supply. Arterial supply. The hip joint is supplied by the branches of the following arteries. Medial circumflex femoral artery, lateral circumflex femoral artery, obturator artery, superior gluteal artery, inferior gluteal artery. The acetabular branch from the obturator artery enters the hip joint through the gap between the acetabular notch and transverse acetabular ligament. To supply the acetabular fat, a branch from it accompanies the ligamentum teres femoris and supplies head of femur. Medial circumflex femoral artery gives retinacular branches and run along the neck of the femur through the retinaculum of the capsule of the hip joint. Nerve supply. The innervation of the hip joint comes from femoral nerve, a branch from anterior division of obturator nerve, a branch from accessory obturator nerve, a branch from the nerve to quadratus femoris, a branch from the superior gluteal nerve. Lymphatic drainage of hip joint. The lymph vessels from the front aspect drain to the deep inguinal nodes, while those from the posterior and medial aspects run with the gluteal and obturator arteries, respectively, to reach the internal iliac nodes.